Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we have a crucial episode discussing the lingering effects of the COVID-19 pandemic, including the debilitating fatigue experienced by many, the evolving variants, and new therapeutic strategies that are emerging to help manage the disease and its after effects.
That's right, Emma. As the pandemic stretches on, one of the major challenges that people face is the post-acute sequelae of SARS-CoV-2 infection, also known as post-COVID syndrome, PCS. Fatigue is a key symptom, and it's not your regular tiredness. We're talking about severe exhaustion that continues long after people recover from the acute phase of the infection. In fact, studies show that 86% of people recovering from COVID-19 experience fatigue.
Exactly. And the impact of this fatigue is enormous. It's often linked to changes in brain connectivity, which can make cognitive functions much harder. This has led to what people are calling brain fog. The symptoms can be devastating for quality of life and work status. Alex, isn't it fascinating how research shows different patterns of brain connectivity between mental and physical fatigue?
It really is. The study we're referencing found distinct patterns in the frontal, temporal, and cerebellar regions of the brain, underscoring how complex this fatigue is. That's why understanding the neural mechanisms behind it is so crucial for creating effective treatments. This isn't just about boosting energy, it's about addressing deep-rooted issues in the brain.
Exactly. And speaking of challenges, let's not forget about the evolving variants of the virus. The Alpha, Beta, Delta, and Omicron variants have shown enhanced transmissibility and even evaded immune defenses, making it harder to control the spread. These variants have presented real hurdles in terms of both vaccine efficacy and treatment options.
Absolutely. For instance, the D614G mutation in the Omicron variant has made the virus even more infectious by increasing its binding affinity to human cells. Mutations like N501Y have also been pivotal in enhancing transmissibility, which is why we've seen such rapid spread in waves associated with these variants.
But beyond vaccines, let's discuss some of the therapeutic strategies being explored, including convalescent plasma, which has been widely used, though with mixed results.
Convalescent plasma, derived from recovered patients, was initially seen as a promising treatment option because it contains antibodies that might help fight the virus. However, recent studies have shown that it doesn't significantly reduce mortality rates or improve outcomes in severe cases. It's most beneficial for specific populations, like immunocompromised patients.
Yes, and the variability in antibody responses among donors complicates its use. That's why there's been a shift toward looking at other treatments, such as emerging medicinal plant-based options. One fascinating candidate is Marantodes pumilum, or SKF7, a Malaysian plant extract that has shown significant antiviral and anti-inflammatory activity against both the original Wuhan strain and the Omicron variant.
That's right, Emma. SKF7 inhibits the virus's 3CL protease, which is critical for viral replication, and modulates inflammation by targeting the TLR4 signaling pathway. This dual action makes it a powerful option for further study. What's even more promising is that it's effective against multiple strains, positioning it as a potential game-changer in COVID-19 therapy.
And it's not just about treating the virus itself. Rehabilitation plays a massive role in recovery, especially for those experiencing long-term effects like fatigue. Rehabilitation interventions, whether it's respiratory therapy or psychological support, are essential to help patients regain their strength and improve their quality of life.
Yes, rehabilitation has proven to be effective across the stages of COVID-19 recovery. Early pulmonary rehab, for example, can improve lung function, while long-term programs focus on restoring physical condition and mental health. And let's not forget traditional Chinese medicine practices like Tai Chi and acupuncture, which have been integrated into some rehabilitation programs to further support patients.
That holistic approach is so important. And another natural support system for COVID-19 patients is ensuring adequate vitamin D levels. Research has shown that maintaining serum 25-hydroxy vitamin D levels above 30 nanograms per milliliter can reduce complications, particularly thrombotic ones. This makes vitamin D supplementation a simple yet potentially life-saving intervention.
Exactly. Vitamin D modulates inflammation and immune responses, helping to reduce the risks associated with COVID-19. with studies showing its protective effects against thrombosis. This is key because thrombotic events are a serious concern in COVID-19 patients, especially those with severe disease.
And that brings us back to the importance of addressing all aspects of the disease, not just the virus itself. Another promising area of research is the use of Marantodes pumilum to target both viral replication and inflammation. Its ability to inhibit the virus's replication process while also reducing inflammation makes it a unique candidate for further clinical trials.
Definitely. And while SKF7 has shown impressive results in vitro, further research in animal models and eventually human trials will be crucial to see how it performs in real-world scenarios. The ongoing evolution of the virus, with new variants emerging, means we'll need all the tools we can get, including novel treatments like this, to stay ahead.
And while we're still waiting for large-scale studies to confirm these findings, the potential for plants like SKF7 to be part of the COVID-19 treatment landscape is exciting. As always, we encourage our listeners to stay informed about both conventional treatments and herbal remedies. These integrative approaches can offer a more comprehensive way to address long COVID symptoms.
Exactly, Emma. I want to remind our listeners that while it's great to explore natural options, always consult with healthcare professionals, especially if you're considering adding supplements like vitamin D or exploring herbal options like Marantodes pumilum.
That's a good point. It's always best to approach these treatments with expert guidance. And for anyone looking for more natural approaches to health, you can explore additional herbal remedies in the Lost Book of Herbal Remedies, available on herbalbloom.org. Now, speaking of herbal approaches, let's dive into some of the specific remedies that have been gaining attention for their potential in supporting post-COVID recovery.
Absolutely, Emma. One of the standout herbs we're seeing in this space is Nigella sativa, also known as black seed. It has long been used for its antiviral and anti-inflammatory properties, making it a great option for people recovering from viral infections like COVID-19. Studies have shown it can help reduce the severity of symptoms and even support immune function.
Another herb that's been highly effective is Withania somnifera, or ashwagandha. Known for its adaptogenic properties, ashwagandha helps the body cope with stress and fatigue, which is exactly what post-COVID patients need. It's been shown to improve cognitive function and overall quality of life, particularly for people dealing with the brain fog we mentioned earlier.
And to complement ashwagandha, Ganoderma lucidum, also known as reishi mushroom, is another great option. It's famous for its immunomodulating effects and ability to reduce inflammation, which is key in helping the body recover from the long-term effects of COVID-19. Reishi can help support immune function, which is critical for patients who are dealing with lingering symptoms.
Another herb that's gaining attention for its antiviral properties is Scutellaria bicalensis, or Baikal skullcap. This herb is rich in flavonoids, which have been shown to have neuroprotective effects. It's particularly useful against viral infections like SARS-CoV-2 and can help alleviate some of the neurological symptoms seen in PCS patients.
Exactly, and let's not forget about Panax quinquefolius, commonly known as American ginseng. It's well known for boosting energy levels and cognitive function, which can be incredibly helpful for individuals experiencing post-COVID fatigue. American ginseng also enhances the immune response, making it a solid addition to any recovery regimen.
And speaking of immune support, we have to mention Marantodes pumilum, or SKF7. We talked about its impressive antiviral and anti-inflammatory properties earlier, but it's also part of this herbal formula because of its broad effectiveness against different strains of COVID-19, including the Omicron variant. It truly acts as a dual-action therapeutic, targeting both the virus and inflammation.
That's right, Emma. Now, beyond these herbs, it's important to highlight the role of nutritional support as well. For instance, vitamin D3 is crucial. We've already talked about its role in reducing thrombotic complications, but it's also essential for immune health and has been shown to reduce inflammation, particularly in COVID-19 patients.
Yes, and omega-3 fatty acids, specifically EPA and DHA, are also essential. These fatty acids help reduce inflammation, support cognitive function, and could even alleviate some of the fatigue associated with post-COVID syndrome.
Absolutely. And let's not forget magnesium, which supports muscle and nerve function and can help relieve the muscle fatigue and cognitive difficulties that so many post-COVID patients experience. It's an excellent complement to both the herbal and nutritional support we've discussed.
This holistic approach, Combining herbs like ashwagandha and Nigella sativa with essential nutrients like vitamin D3 and omega-3s can make a big difference in recovery. But as always, it's important to consult with a healthcare provider before starting any new supplements or herbal remedies to ensure they're safe and appropriate for your unique health situation.
That's key, Emma. Safety and personalization are everything when it comes to health interventions. Make sure to follow recommended dosages and source your herbs from reputable suppliers to avoid any issues with quality or potency. And keep an eye on any potential interactions with medications you might be taking.
Great advice, Alex. As we wrap up today, remember that recovery from COVID-19 is a journey. Whether it's managing post-COVID fatigue, dealing with the evolving variants, or exploring therapeutic options, a combination of modern medicine and herbal remedies can offer a well-rounded approach to healing.
Thanks for joining us on this episode of the Lost Book of Herbal Remedies. We hope today's discussion on COVID-19 recovery strategies, herbal remedies, and therapeutic insights gave you valuable tools for navigating these challenging times.
And don't forget, you can learn more about these herbal remedies and their uses by visiting herbalbloom.org. Stay informed, stay healthy, and we'll see you next time on the Lost Book of Herbal Remedies.